Hello everyone, my name is Amisha and I'm going to be talking about fluorides and its effects. And I'm also going to be talking about the fluoride controversy. For a long time there has been an ongoing debate among dental and health professionals about whether or not fluoride is actually good for humans or not. There have been groups who support the theory that fluorides are beneficial, while there has been another group which considers fluoride to be toxic and hazardous. The purpose of this paper is to present results of studies of both sides. What are fluorides and where can they be found? Fluorine is a member of the halogen family which forms inorganic and organic compounds called fluorides. Fluorides can be present as gases and particulates in the air. They can be present in water, mostly as fluoride ions or combined with aluminium. They can be found in soils, mainly combined with calcium and aluminium. They are found in living organisms. Maximum is found in the fish. They are found in large number of food substances with a maximum content found in tea leaves. How are humans exposed to fluorides? The individual exposure to fluorides is highly variable and depending on the level of fluoride in drinking water, foodstuffs, toothpastes, indoor and outdoor air by inhalation routes, mouth rinses and topical applied dental procedures, fluoride supplements, fluoride milk, and salt. Humans can also be exposed to fluorides by occupational exposure through inhalation or dermal route. Other factors such as temperature of the region, the concentration of and aqueous solubility of the form of fluoride, and the absorption capacity of the individual determine the level of fluoride in the body. Talking about the optimum and toxic level of fluorides, to protect teeth from decay, the best level of fluoride in drinking water is between 0.7 to 1.2 mg per liter. The toxic dose for fluoride ingestion is 5 to 10 mg per kg, while the estimated lethal dose is 5 to 10 grams in adults and 500 mg in small children. Should fluorides be added to water, toothpastes, and other food substances has always been a subject of controversy from as early as 1930. The two extreme groups do not agree with each other on this fact. Why has exposure to fluorides increased? Exposure to fluoride has increased since the early 1960s. At that time, drinking water and food and beverages prepared with fluoridated water accounted for nearly an individual's entire fluoride intake. Today, exposure to fluoride comes from more sources, including fluoridated dental products such as toothpaste and mouthwash, as well as voluntary addition of fluoride to drinking water, which some systems do as a public health measure for reducing tooth decay. What happens to the fluorides absorbed by the body? The fluoride is distributed rapidly by the systemic circulation to the intracellular and extracellular water of the tissues. In humans, approximately 99% of the total body content of fluoride is found in bones and teeth, as this is the area where it is retained. Increasing amounts are being observed in the pineal gland and other endocrine glands such as the thyroid gland. There has been an increased amount of fluoride detected in the brain of growing children. Fluoride is eliminated from the body primarily in the urine. Talking about the disease caused by excess intake of fluorides, it is known as fluorosis. Fluorosis is a condition which is caused by deposition of fluoride in the body because of excessive intake. Moderate amount leads to dental effects, but long-term ingestion of large amounts can lead to potentially severe skeletal problems. The dental effects of fluorosis develop much earlier than the skeletal effect in people exposed to large amounts of fluorides. Acute high-level exposure to fluorides causes immediate effects of abdominal pain, excessive saliva, nausea, and vomiting. Seizures and muscle spasms may also occur in such patients. The effects of fluorosis are irreversible. Going on to the types of fluorosis, well, basically there are two types of fluorosis, that is skeletal fluorosis and dental fluorosis. Skeletal is considered to be a marker of long-term exposure to fluoride due to the ongoing process of bone remodeling. It may range from mild to severe crippling disease. The mild form is difficult to diagnose because the bones are not readily visible and because other conditions can also cause similar problems. The severe form causes brittle bones and joint pain. It causes limited movement of the joints and skeletal deformities. As of now, there are no established treatments for skeletal fluorosis patients. Talking about dental fluorosis, it is observed earlier than skeletal fluorosis. It manifests due to excess intake of fluorides before the age of 8, as this is when the teeth are in the developing stage. Mild fluorosis causes the teeth to have a white spotted or lacy appearance, while severe fluorosis results in enamel being markedly hypomineralized, and enamel may be brown in color, and it has a propensity to break and excessively wear. This condition is also irreversible. Dental fluorosis can be cosmetically treated by a dentist. Talking about the effect of fluoride on other tissues, studies have found that fluoride can enter and damage the fetal brain, leading to low IQ and impairment of learning. Studies have also shown that the pineal gland accumulates huge amounts of fluoride, causing its dysfunction. Any agent that affects the pineal function could affect human health in a variety of ways. Fluoride is used as a thyroid suppressing medication for patients with hypothyroidism. The action of fluorides on the kidneys and occurrence of cancer is under study. So we can see that fluorides have a very negative impact on the body too. There are a large number of endemic areas which show fluorosis. There are about 22 countries which show endemic fluorosis. It is most commonly observed in India and China, which are the worst affected. It is also present in Mexico in the north and Argentina in Latin America. East and North Africa are also endemic to fluorosis. Because of the excessive amount of fluoride in the water, many communities have to adopt defluoridation of water for the welfare of the people. The method of defluoridation can be coagulation, in which 50% of fluoride is removed, or by using activated alumina, which removes 80% of fluoride, or by using membranes, which also removes 80% of the fluorides. The other methods such as calcined clay and bone charcoal are less used. Many countries have banned the use of fluorides, keeping in mind the welfare of the public, because new researches have been coming in, and they've been proving that fluoride is actually a toxic used to kill rats, and putting even a little amount of fluoride in the dietary foods and dietary water is not good for the humans. Such countries which have banned the fluoridation processes are Sweden, Norway, Denmark, West Germany, Italy, Belgium, Austria, France, and the Netherlands. Despite these restrictions of fluoride, the US still favors on with the goal to fluoridate community water supplies in the United States. To conclude, I would aptly put it in words as there is no conclusion to the controversy of fluorides and its effects. The public needs to be educated about fluorosis. This will enable them to modify their intake of fluoridated substances. And health professionals and policymakers need to come together to make a definite, conclusive decision about fluoridation of water and foodstuffs, keeping in mind the welfare of the public. Thank you.